So today I would like to do this question on thiamine. Let us say this. A 32-year-old woman with hyperemesis gravidarum presents with prolonged vomiting, confusion, and horizontal nystagmus. She is severely malnourished and hypoglycemic. Glucose is 45 mg per deciliter. The medical team prepares to administer intravenous IV dextrose. What is the most critical intervention to perform before giving IV glucose in this patient? A. Administer IV folate to prevent macrocytic anemia. B. Give IV thiamine 100 milligrams to prevent vernix encephalopathy. C. Start IV magnesium sulfate to prevent seizures. D. Infuse normal saline 0.9% NaCl for volume repletion. E. Check serum vitamin B12 levels to rule out neuropathy. So, first understand the patient's situation. We have a 32-year-old woman who is having prolonged vomiting, confusion, and horizontal nystagmus. She is severely malnourished. So, that is something to think about. She is malnourished. And her glucose level is 45 milligrams per deciliter. So, when you see someone with hypoglycemia, you will be tempted to immediately give her IV dextrose. And the questioner is saying, do not do that. If you give IV dextrose to this malnourished patient, she will be going into a very, very serious, even fatal situation. That is the focus of this question. So, if someone is malnourished, either due to self-imposed dieting plans, or due to bulimia nervosa, or anorexia nervosa, or chronic alcoholism, you may be tempted to give IV glucose. And this happens all over the world. People just give IV dextrose. And these poor people will go immediately into thiamine deficiency. They immediately go into vernix encephalopathy. That is the focus of this question. And the correct answer is B. The patient's confusion and nystagmus suggest vernix encephalopathy. Giving glucose without thiamine would worsen her neurological status. The classic trait of vernix encephalopathy is confusion, ataxia, and nystagmus. Thiamine or vitamin B1 deficiency is common in malnourished patients. Glucose administration without thiamine can precipitate vernix encephalopathy because thiamine is a cofactor for pyruvate dehydrogenase and alpha ketoglutarate dehydrogenase. Without thiamine, glucose metabolism shifts to anaerobic glycolysis, lactic acidosis, and ATP depletion in neurons. Mammillary bodies and brainstem nuclei are especially vulnerable. So, little bit of biochemistry would help you to understand what is happening in this situation. A little bit of biochemistry would help you to answer this question very, very well. Okay, remember Krebs cycle or citric acid cycle. When you give glucose to this patient, what happens? This glucose goes into glycolysis and this patient will have a lot of pyruvate. And the pyruvate needs to convert into acetyl-CoA using pyruvate dehydrogenase. So, pyruvate dehydrogenase needs thiamine. In the same way, alpha ketoglutarate dehydrogenase, it also needs thiamine. So, without thiamine, these two basic enzymes in citric acid cycle would be deeply impacted. All right. Pyruvate dehydrogenase, without pyruvate dehydrogenase, pyruvate cannot convert into acetyl-CoA. And without alpha-ketoglutarate dehydrogenase, alpha-ketoglutarate cannot convert into succinyl-CoA. So what is happening? You gave dextrose to this patient, and the patient produced a lot of pyruvate in his glycolysis, and the pyruvate cannot enter into citric acid cycle to produce energy for his brain and other organs. So this pyruvate gets converted into lactic acid, and the patient develops metabolic acidosis and nervous damage. All that lactic acid, all that metabolic acid will impact his brain. There is no energy. Even though you gave him lots of dextrose, it is not entering citric acid cycle because thiamine is deficient. And all the lactic acid is being produced, and it will go and seriously damage his mammillary bodies, his thalamus, and his cerebellar vermis. So that is how the damage happens when you give IV dextrose to these patients without first giving thiamine. The reason to give thiamine is to protect his brain. So first give thiamine and then give IV dextrose. So that is very, very important points. The mnemonic you can use is glucose burns neurons without thiamine. Glucose burns neurons without thiamine. So remember that. Glucose burns neurons without thiamine. So always give thiamine before you give any other liquid to these malnourished patients. The classic question is, a chronic alcoholic comes to the hospital and he has so many issues, and what are you going to give him first? It's always thiamine. All right, folks, now looking for the incorrect answers. A, folate treats macrocytic anemia and it does not prevent Wernicke's encephalopathy. C, magnesium sulfate is used for eclampsia, seizures, not thiamine deficiency. D, saline rehydration is important but does not prevent glucose-induced Wernicke's. E, B12 deficiency causes subacute combined degeneration, not acute encephalopathy. That is the reason those incorrect answers are incorrect. If you want to practice yourself for your exam, we have like thousands of these questions. Right now, we have over 2,700 questions written in board style for USMLE and NEET. So go to our website www.supertestscores.com and practice yourself, and I assure you this is only $10 per month. Okay, don't waste tons of money on expensive courses. Just do this one course for you USMLE exams, and I assure you, you will get a great score and land in a residency of your dreams. All right, folks, we will see you in next episode.